What are false positives in colorectal cancer screening? Have you ever wondered what it means when a colorectal cancer screening test shows a positive result, but you don't actually have cancer? This situation is known as a false positive. A false positive occurs when a screening test indicates the presence of colorectal cancer or precancerous lesions, like advanced adenomas, even though these conditions are not actually present. In simpler terms, the test says you might have cancer, but further testing reveals that you do not. Colorectal cancer screening tests, such as fecal immunochemical tests, fecal occult blood tests, or stool DNA tests like Cologuard, look for specific markers that could indicate cancer or advanced adenomas. However, these markers can sometimes show up for other reasons that are not related to cancer. For instance, a stool DNA test might detect certain DNA or blood markers that suggest a risk for cancer. But when you go for a colonoscopy, it turns out you do not have colorectal cancer or advanced adenomas. False positives are not uncommon in colorectal cancer screening. Research shows that about 13% of patients who do not have colorectal cancer or advanced adenomas will receive a false positive result from the Cologuard test. The likelihood of receiving a false positive can increase with repeated screenings over time. For example, if a test has a specificity of 98% and is done annually from ages 50 to 74, it can lead to a cumulative false positive rate affecting over 10,000 people per 100,000 screened. This means many individuals may experience at least one false positive during their lifetime of screenings. Receiving a false positive result can have significant consequences. It may lead to unnecessary follow-up procedures, especially colonoscopies, which come with their own risks, such as bleeding or perforation. Additionally, a false positive can cause psychological stress, including anxiety and discomfort. It can also affect how individuals feel about their health and their willingness to undergo further screenings. In summary, false positives in colorectal cancer screening are test results that incorrectly suggest the presence of cancer or precancerous lesions in individuals who do not have them. While they are a limitation of screening tests, it is essential to weigh these false positives against the benefits of early cancer detection. If you receive a positive screening result, it is crucial to follow up with a diagnostic colonoscopy to confirm or rule out any disease. Healthcare providers should communicate the possibility of false positives to patients, helping them make informed decisions and reduce anxiety about the screening process. Always consult with your healthcare professional for personalized advice regarding screenings and test results.